Hi guys, my name's Zach. I'm a lecturer at the Hull University, and today in this video we're going to go through how to do a literature search through EBSCO. I'm going to take you through keyword selection, increasing the amount of keywords, and what kind of things you should be putting your keywords into, some things like PICO or some spider diagrams. We're then going to go through an actual literature search. I'm going to show you how to clearly document that and use a PRISMA diagram to make sure that people can actually repeat that, and that'll increase the robustness and reliability of your own literature review that you'll eventually be submitting. The first thing that we have to actually consider is what is our research question. And I'm just going to take you onto this screen over here so that you're able to see my research question for today is what are paramedic students' perceptions of peer-assisted learning? And I've put those into a few PICO diagrams below just to demonstrate them. PICOs are really good if you're actually going to quantitatively measure things, if you're going to have an intervention that you're hoping is going to have an effect on something. But sometimes they don't quite fit for those qualitative works where you're just wondering what somebody's perceptions are. So if we take a look at what I've done here, if we go down onto the PIC or the PICO, you can see here that the population and the intervention and the comparison. And the population is obviously paramedic science students, which I've taken from the above bit here. Peer-assisted learning is important to me, and that's what I want to find out about. But I don't really have a comparison. My comparison is simply just programs that are not using peer-assisted learning. There's also something called PI as well, which sometimes fits quite well. Again, the population is paramedic science students, intervention is peer-assisted learning, and the evaluation, what I'm actually looking for are the opinions, the perceptions of those paramedic students. Something that's really actually going to fit quite well is something called SPIDER, and that's sample, phenomenon of interest, design, evaluation, and research type. And what you can do here is you can put your sample population in and then your phenomenon of interest. So for me, as you can see on here, I've got my paramedic science students, and my phenomenon is the delivery of peer-assisted learning. I could also include the design of studies that I want to do. So I've opted to have observational studies where lecturers are observing these sessions and gathering the opinions of paramedic science students. Also, I can look at prospective or retrospective studies. So that's prospective going forward or retrospective looking back in time on those sessions. My evaluation, I want to have a good idea of what the paramedic science students' experiences, perceptions are, but maybe also if it actually affects their grades or marks. And the research type that I'm happy to either include quantitative or qualitative work. And that's really good because it starts to set out some inclusion and exclusion criteria. There's another one as well, as you can see, known as SPICE. And this is another good one if you're looking at something that's a qualitative piece as well. You're not looking for those numbers, those statistics. So your setting will be higher education for me. I'm interested in university students. My perspective is the perspective of paramedic science students. And the intervention that I want to make on these students is to actually subject them to peer-assisted learning. I'm not bothered about a comparison, I just want to know their perceptions, but I maybe want to know their predicted or actual grades as well. And that works really well for some of those as well, that you're going to be trying to slot into a PICO that doesn't quite actually fit. So if we just take a little bit of a further look down, the next thing that's really important when you're considering your literature review is the use of keywords. And this is really going to make or break your literature review in the amount of evidence that you can find. You want to be trying to think as many keywords as you can. And the reason for that is sometimes things are called different things abroad. Sometimes they may contain a dash or they may not. So as you can see here, I've actually put paramedic science student, but I've got an asterisk at the end, and that's really important because what that'll do is when it searches, it'll actually find for paramedic students and include the S on or anything after that. So I don't have to do paramedic science students and then paramedic science students. It just cuts down my workload. Again, I've got student paramedic as well, because some research papers may call them that. And I've got paramedic science student, I've got paramedic student, trainee paramedic, and also I've tried to think a little bit broader as well about maybe just people who maybe just look at paramedic science in general from a program perspective as well. And then the next thing I've got to think about is my phenomenon, what I want to find out. And that's peer-assisted learning, but it can be called a lot of other things. So sometimes your phenomenon is worth a Google search to see what it could actually be called, because again, things might be differently. And as you can see here, they're very different as well. We've got peer learning with a dash. We've got peer-assisted learning with a dash. We've got peer-assisted learning, but we've got peer-assisted learning strategies as well, which is another thing that it can be called in the literature. And we've got peer-assisted learning brackets PAL, which is often called as well, but also sometimes it's called peer tutoring. So the reason for this is that I'm trying to search as much as the literature as possible, and using these variations of keywords allows me to try and include as many things as possible. So when you're coming up with your keywords, try and have a think, what else could things be called? If I wanted to make it more international, I might actually call paramedic science students EMTs, emergency medical technicians, or some other variation of what they're known as globally. Okay, so let's move on then. There's three things that you're going to need to have open when you start your literature search. Your first thing is your keywords. Your second thing that you're going to need to have open is EBSCO, and that's going to be your academic search engine that you're going to actually find the literature through. And the next thing that you're going to need to have open is your Prisma chart. And Prisma charts are really good to get across your search strategy, how many papers you found, but also, as you can see, as the chart moves down, it actually allows you to say what you've done with those, how many you've had a look at the title and decided that that's not very good to include based on your exclusion criteria, how many you've physically downloaded and had a look at, but also how you found other articles and things, and we'll have a look at that a little bit later when we get down into the research. So have these things open, and then it's going to go much more smoothly. So the first thing to do when we actually get into EBSCO is start to choose our databases, and that's really important. What we don't want to do is not select an appropriate database that's going to then limit our results. So if we go onto the Choose Databases tab here, and what we can do is we can actually select things as well. There's a lot of good things and there's a lot of bad things that you're not going to need to include. So let's take a look at them. We want to include Academic Search from here, and we want to include CINAHL as well, which is a database for allied health professions, obviously very good for paramedic science students. We want to include Education Research Complete because I'm concerned with education, but if you're concerned with something clinical, it's probably not appropriate to include that. And ERIC as well, which is another education database. Obviously, Medline is obligatory to search. That's the American database, so really good to have that as well. And the rest of these, what you can see are some psychology related things, which are really good if you're looking at something perhaps with confusion in patients, or you're looking for the perceptions or psychoanalysis of paramedics maybe going through trauma or something like that. And the rest of them really are sports related things or ebooks. So make sure that you have all of the right things selected before you start your literature review, and it's going to increase the amount of things that you get. So we can click OK there, and that'll save all those, and that'll mean that I'm searching those as well. And what we're going to do is we're going to plug each word in individually. The idea behind that is that each keyword I'll be able to demonstrate the number of hits, and then eventually I'm going to combine all of those with some Boolean phrases to come out with an overall number. Okay, so first of all, we're just going to be searching the keywords that we've got. Let's take a look at the first one. The first one that we've got is paramedic science student. So simply what I'm going to do is I'm going to copy and paste that, move it over here, and I'm just going to search for it. Okay. And what we can see, you want to be hitting on the search history button now. And what we can see here is that this search has brought us with 28 results, which seems relatively low. So we're going to document that. So we'll go over to my documenting table down here. So we search for paramedic science students, which gave us 28 results. We're then going to search for student paramedic, and when you do these searches, it's really important to clear that bit, or you're going to get it really confusing, and it's going to be confusing. So make sure that bit is blank before you start. So let's search for just student paramedic, see how many we get. 1,278. 1,278. We're then going to go student paramedic without the asterisks, just to make sure that we capture all of those potential ones that could maybe be missed. See, it's given a very different number there, 886. And the reason for that is probably the rest of these articles here had an S on the end. So that's why using an asterisk is really important. We're going to search for paramedic science. Again, deleting that, doing a fresh search each time. With that, we get 337. And then finally, we're going to do trainee paramedic. And that gives us 24. And then what we're going to do is we're going to search all of those with the Boolean phrase or. And what that's going to do when I do this search is it's going to find any paper published that has those words in them. And we're probably going to get quite a big number. So we're going to do all of these searches. So make sure again you delete it in the top. You can select all of these, the little tick boxes, and we're going to search with or. It takes a little bit of time because it's a big search, so it's 1593. And make sure here you document that this is S1 or S2 or S3 or S4 or, and then that just enables you to keep track of the search, because when you're doing larger searches this can get really quite confusing. The next thing that we're going to do is we're going to have a look at how many hits we get for the peer learning aspect, and then we're going to combine them eventually and see what we come out with. So we're going to go first with peer assisted learning. And we get 1,368. We're going to put a dash in that and then search that one. $1,368, so looks like those are searching exactly the same papers, so that's a good thing. Peer learning, because it can also be called peer learning. Wow, 13,496. 13,496. Let's go peer learning with a dash. And I wonder if it's going to be the same as the last one. Yeah, 13,496. Peer-assisted learning strategies. And what you'll see is sometimes it comes up here with some helpful tips of what it could be called as well. So let's search that one. 250. So if we hadn't have done that, we would have potentially missed 250 articles. We're going to do peer tutoring as well, because that could potentially bring up some things as well, such as problems-based learning. 8,750. And then exactly like before, what we're going to do is we're going to search this intervention bit, ticking all of those again, and we're going to search them with all. So we're looking for any article that contains any of those. We're probably going to get a pretty big number here. 20,353. 20,353. Okay, and let's just make sure that we document as we go along. That is S6 or S7 or S8 or S9 or S10, S11. So this has been a pretty big search. And now what we want to do, our final search, in which we're going to find these papers that contain paramedic science or any of those that we've put along up here. So all of these searches, we're then going to look for those and use the Boolean operator and this intervention group as well. And hopefully that should bring our search right down. And you should see that we'll have a lot less papers. So let's get rid of that. So that is our sample search, which we're going to tick. We want to search that, and we want to search any of our sample that contain any of these. So we're going to search that with an and, because we want all of those in. So let's do that and see what we get. So we've got 10 results, so that's pretty good. Let's take a look at these results. So sometimes you'll get things thrown up that aren't very viable, but it's always good to have a look at your results and see what you've got. So we've got a good one there. Peer-assisted learning is a scoping review. What value does peer-assisted learning have in the training of student paramedics? That sounds very good. Peer-assisted learning, so that's undergraduate midwifery. Peer-assisted experiences find a unit of paramedics. That sounds really good. Student midwives and paramedics experiences of shared learning. That's probably not it. We're only looking for peer-assisted learning. Near-peer teaching and paramedic education. That sounds quite good. Hidden curriculum. No, I would exclude that. Peer-assisted teaching and interventional study. That sounds quite good if it contains paramedics. Peer mentoring as a strategy to improve paramedic student skills. That sounds good again. And can near-peer peer teaching improve academic performance. So it looks like we've come up with some pretty good papers there. Other thing that you sometimes need to consider is that you need to consider the date ranges that you're searching. And I haven't actually included those now nor within this. What we would normally do is search within the past 10 years, but sometimes you can get a lot of literature out there that's produced before that as well. So if you're not getting much, this is a troubleshooting tip, you might have to expand your age range a little bit to maybe 15 years and have a play with it and see what you come up with. Another thing that we're going to want to do is make sure that we only get articles from peer-reviewed journals. So you can tick that scholarly peer-reviewed tab there and see if that makes any difference. So it's still giving us 10 articles. We want to be able to access the full text of the article, of course, because we need to have a look and see if it's going to be appropriate or not. And that takes us down to 6. But for the purpose of this, I'm going to take that off because sometimes you can get access as well to the full text. So let's take a look at those in terms of putting them in. So we've now documented our search. So we're going to do, we have done S5 and S12. And the results that it has given us is 10 results. Okay, so hopefully now if you watch this video back and you follow these steps, you should come out with exactly the same number as me, give or take, but you should definitely come out with 10 of the same articles that I have. And what I've done there is I've documented my search to make sure that it's robust and rigorous, and that's something that you should be trying to do in your academic work as well. So let's take a look at the Prisma chart now. So the Prisma chart has got 2 things on the top. It's got records identified through database searching. That's what we've just done. But it's got another thing as well, additional records identified through other sources. And that's really good, that if you maybe get sent an article, or sometimes you start your literature search and you actually know already of some articles, but they don't come up. So that's good for including things that you had expert knowledge of beforehand. For me, I didn't have any, so we'll just put 0. Records identified through database searching, well, we had 10 of those. And there were no duplicates, so that is a 10 again. And we screened them at title. So we screened 10 articles. And a good tip here, what you can start to do is you can start to put these in folders now of what you think is good. So for full text review, which we're going on, I'm going to start to have a look at the titles and decide what I don't think is appropriate. So this is peer-assisted learning. I think that this will be appropriate. I'm going to put it in a folder with this little button here, and you can see it's gone on the left side there. Peer-assisted learning, that sounds really good. Crossing professional barriers, underrepresented students teaching undergraduate paramedic students, that sounds really good. We'll have a look at that one. Peer-assisted teaching experiences of final year paramedic students, that sounds good. Student midwives and paramedics experience of shared learning in a pre-hospital childbirth, that could be one that I could potentially exclude. I'm more looking for the educational aspects of it. Near peer teaching in paramedic science, that sounds good. Hidden curriculum in near peer teaching, not sure, but I'll have a look at it. And peer-assisted teaching and interventional study, that sounds good. Peer mentoring as a strategy to improve paramedics' clinical skills, again, that sounds good. And can peer teaching improve academic performance? Hopefully it does. So that's good. So you can see what we've got here. If we click on here on the Go folder view, what we should be able to do is then tally up how many articles. So we've got a total of 9 articles here that we've only excluded 1 at title. And this next step is really important, and this is where you actually physically download the full text and have a look at them. You have a look at the abstracts and you have a look at the full text. And the important thing on this step of the Prisma is that as you're excluding those articles, you will then be documenting your reasons why. And this could be done in a table in the appendix of your assignment or on your literature review, and that's really important. And to increase robustness and rigor, what you can actually do is have your academic supervisor, a friend, a colleague confirm that with you as well, or a fellow student. And what that shows is that 2 of you have looked at it and actually excluded them. The other thing that you can do to increase the amount of articles that you have access to is on the left side here. This full text articles located through reference searching. And what a really good thing to do is actually to have a look at the references of these 9 full text articles. And sometimes you'll find things that are thrown up there that you can include that you wouldn't have found necessarily through the database searching, because sometimes it doesn't hit all of those things. And that's a really good technique. And I've had a few students who've only had 2 or 3 papers. We've had a look at the reference list and found a few more to go on top of that. And that's the literature search. One of the most common problems when searching for literature that I guess asked for by students is that they don't find many articles And one of the tactics that I use for this is sometimes increasing the date range, but commonly the problem lies with the keywords that are being searched. Remember, when you're searching for these articles, you have to try and include as many keywords as you can, because things can be called different things. So if you're searching for a paramedic, make sure that you also search for perhaps an EMT if that's abroad, or if you're searching for perhaps perioperative medicine. Perioperative in this country does not have a dash, whereas in America it will have a dash between the peri and the operative. So the problem sometimes lies with the keywords, and the important thing there is to try and have as many keywords as you can as possible. Another really good thing is not to fret too much if you get to the end of your literature search and you've only got 3 articles that you can include. A tactic for this is forwards or backwards reference searching, and what that is those 3 articles, have a look in the reference list and see if you can actually find any articles that weren't thrown up in your literature search. And this is a very legitimate way of increasing the search, increasing the amount of research that you can include within your literature review. Another really common problem is that some people do their literature search and they'll finish it and end up with somewhere between 1,000 or more articles that they have to look through. Sometimes that does happen for people who are doing a very big funded meta-analysis, but for a university student I wouldn't expect you to be looking through more than 100 articles really, and even that's at master's level dissertation. Again, the problem lies with the keywords that are used. Sometimes the keywords are too broad, and what you might have is somebody looking for communication tools, but instead of writing communication tool, they simply write communication. One of the problems with that is that it's going to throw up any article that has got the word communication in it. So a really good way to try and limit the amount of articles is to be very specific with the keywords that you want to find. So something like communication tool or handover tool will be a lot better than just writing communication. Or if you're looking for something more on communication styles, you would then include the words communication style. Try and be specific with your terms, but not too specific that it limits it. Sometimes it's a bit of a fine balance.